Hi, I'm Eileen Karina, and I'm with Pulse Center for Patient Safety, Education, and Advocacy. And I'm here with David Fielding, a board-certified patient advocate with Engage Caring Solutions. And we're going to talk about David and the work that he's doing and the Take Charge campaign. David, could you start off with just telling us a little bit about your business and your background?
Good morning, Eileen, and thanks for having me. I've been privileged to be able to work in healthcare for some 35 years, and have now transitioned to a second career as a board certified patient advocate, helping families and patients negotiate the healthcare system, get better treatment by their clinicians, find their voice so that they can raise questions and get answers and make informed decisions, and generally reduce the stress level and feelings of being overwhelmed by medical care and medical issues going on in their lives.
I know you're located in New York, but could you do this work with anyone?
Sure, I've had clients in a number of different states. The issues pretty much are the same regardless of where in the country care is being provided. Doctors are doctors, nurses are nurses, and a lack of communication and coordination is consistent throughout the healthcare system. My particular area of expertise is working with seniors. I love it. I've spent 30 years as a regulator and a healthcare executive working in long-term care and rehab facilities, and also regulating the home care agencies in the New York City region.
So, David, tell me your interest in Take Charge. You've been involved from the beginning. You helped develop the program. Why is it important to you or to the work that you're doing specifically?
The Take Charge program addresses, I think, one of the most pressing needs in the healthcare system, and that is elevating the voice of the patient and by association, the patient's family, so to be heard by the clinical team. In the development of the Take Charge program, working with a small team of patient safety experts, we were able to, I think, quickly identify a number of categories of issues that, if addressed, would lead to more successful outcomes, better results, and in each of those instances would help the patient and the patient's family find their voice to raise issues and concerns with their caregivers to make sure that care is not only safer, but produces better results and better outcomes. I think they each build on each other so that as people progress through the steps and they do their advanced directives, they now have their wishes set in motion and they've been able to assert that right as they move to step 2 and they look at building their own personal health record and maintaining a list of current medications. That's one of the key areas for patient safety, in that because of polypharmacy issues and multiple medications and multiple clinicians, it brings the organization of the medication list to ensure that all practitioners have the same list and that everybody's looking at the same information so that somebody is managing all of it at once. With the third one of prepare for doctor visits, prepare a list of questions for your doctor visits, step 3, that's just a common sense approach, but it helps patients and families get over that barrier of the doctor's time is more important than mine. So we kind of slow the meeting down when we're having a doctor's exam to make sure our questions are answered. And preparing a list is a really professional and respectful way of communicating to the doctor we're serious about getting information and answers. The fourth, which is, prevent the spread of infections and wash your hands. I think everybody, because of COVID-19, everybody understands the significance and importance of that now, but I think it serves one other really important purpose, and that is to teach patients to learn how to be comfortable asking their doctors and all of their caregivers to do something to protect them. We're very comfortable following instructions and taking directions from them, even when we disagree, but we're not so comfortable asking them to do something. And oftentimes it comes with a reaction or a response from them. And it's important to teach people that it's okay to ask your doctor to wash your hands, particularly given the fact that it's your health that's at risk, not theirs. But in step 5, use an advocate or be an advocate. I think it's okay for patients and families to acknowledge that they need some help in that environment, that it's easy to be overpowered by the clinical expertise of doctors and nurses and therapists. And sometimes just whether it's a professional advocate or it's just a friend or a family member, just having that one person as a support, that one person with an objective perspective, can really help to identify and address issues by simply asking the questions and holding people accountable to being honest with their answers.
Well, David, thank you very much for this information and for sharing your information on Take Charge. Could you give us your phone number, your email, your contacts, and we'll post it also on the site?
Oh, sure, that's much appreciated. For Engage Caring Solutions, you can reach me at www.engagecaring.com. And my phone number is 917-838-7182. And I always provide an initial consultation at no charge, just so that we can get to know each other and see if there's a need for my services, if I can help.